I want to apply psilocybin to autism spectrum disorder. The first thing I need, remember, I need a proof of concept, a preclinical. So I have to take psilocybin and show that it rescues sociability deficits in an animal model. Now, there are good animal models. There's a valproic acid model of psilocybin, and we now know that a drug that's approved by the FDA can cause autism if you give it to pregnant ladies who are at certain stage of development of the fetus. Behavior in metabolic disorders, the increased production of acute phase proteins and cytokines, this inflammatory language, may promote and contribute to the development of the symptoms we're seeing in autism spectrum disorder. The microbiome. We now know that ASD children have a mix of gut microbes that is distinct from that in children without the condition. And all of these articles are referenced at the bottom. What we're doing is, for example, in the experiment in the autistic rat, we're looking at fecal specimens at different stages of development when they have autistic, 9 days, postnatally, 30, 60, and we're now going to look at the expression of the genes to identify these subspecies of microorganism. So in the next 2 or 3 months, we'll have a lot of data that we could tell the scientific community as to what exact species abnormalities are present in autistic spectrum disorder. I want to take psilocybin, psilocin, maybe another psychedelic like baeocystin, which we're now producing. That's a very important derivative within psilocybe cubensis. And we want to combine that with psilocin and psilocybin and see if we have an entourage effect. And we also want to look at the receptors in NASH, and we'll look at the TRP as well. Disease is awful, whether it's breast cancer or autism or depression or PTSD. We know so little. I want to plead with people to become your own advocates. Life is an experiment of one. Psilocybin has stigma on it, but it could be very helpful. We have to overcome the history, which is positive, that the development, it's nature, it's perfect. Psilocybin is a food. You're eating it. It has things we don't know about. And we need to get the world to start listening to us. And I want to leave a legacy. I hope in the years that I have left that I can leave a legacy and show the application of psilocybin, psilocin, and other psychedelic tryptamine derivatives to cure this terrible, devastating disease called autism spectrum disorder. Thank you very much.